Dr. Nageshwar Reddy, can we begin the session?
Yeah, please go ahead. Please go ahead.
Sir, good evening. Welcome.
Good evening. Thank you.
Good evening to one and all. On behalf of the Federation of Telangana Chambers of Commerce and Industry, I'm extremely delighted to welcome you for today's webinar on Health for All. And thank you so much, Padma Shri, Padma Bhushan, Dr. D. Nageshwar Reddy, for agreeing to interact for this webinar with our members. The FTCCI continues to work for the benefit of its members and society at large. And recently, last week, we had organized a vaccination camp at FTCCI for our members. So we continue to do that. And just before we begin the session, I would just touch upon housekeeping rules. Please keep yourself on mute all the time when you're not speaking. For our viewers, if you have any question for the panelists, please put it in the Q&A and our moderator will take up all those questions towards the end of the session. And in case if we've not been able to take those questions, you can mail it to us and we will get back to you. Before we begin the session, we would like to show a 1-minute film of FTCCI.
The largest business organization of Telangana state. With a legacy of excellence, the voice of the industry, representing the interests of 25,000 businesses of all sizes, sectors and regions. Empowering trade through advocacy, solution and standard setting. Opening new avenues for unprecedented growth. Laying the foundation for an industrial transformation in the state of Telangana. Now, poised for the next century and beyond. The Federation of Telangana Chambers of Commerce and Industry, FTCCI. Together, let's rewrite the vision for a progressive future.
Thank you. I now invite Mr. Ramakant Tinani, President of FTCCI, to deliver the welcome address. Unmute yourself.
Thank you, Ms. Kathy. Eminent medical personality of the country, Padma Shri and Padma Bhushan, Dr. D. Nageshwar Reddy ji, Chairman AIG Hospitals, Mr. Manish Shah, Vice President HDFC Bank, all my colleagues, distinguished participants and media, a very good evening to all of you. It is my pleasure to welcome you all for today's webinar, which is incidentally today's Doctor's Day, and I extend my warm greetings to Dr. D. Nageshwar Reddy on this Doctor's Day. We are very fortunate that this eminent event is being held on a Doctor's Day. I welcome and thank our guest of honor, Padma Shri Bhushan and Padma Bhushan, Dr. D. Nageshwar Reddy ji, Chairman AIG Hospital, for readily accepting our request in spite of his busy schedule to address our members. I take this opportunity to introduce the Federation of Telangana Chamber of Commerce and Industry, which is an 104-year-old apex body representing the interests of trade and industry and commerce in the state of Telangana. FTCCI has constituted an expert committee on health and healthcare and disaster management, which has proactively taken up several measures and initiatives to be of service to the industry and society at large during the pandemic, and tied up with several NGOs to offer oxygen concentrators, plasma services, hotel quarantine, hospital services, online doctor consultation, and other medical services to our members. FTCCI has played an active role in bringing the challenges faced by the industry due to COVID-19, submitted number of representation to the concerned ministries and officials, and also conducted number of webinars with the health experts from ministry, including Dr. Harshvardhan, Honorable Union Minister for Health and Family Welfare, Government of India, and from our state, Minister for Health from our Government of Telangana, and Dr. G. Satish Reddy, Chairman DRDO, and Dr. Prashant Garg, Director L.V. Prasad Eye Institute, Dr. Rakesh K. Mishra, Director CCMB, their team and others. Asian Institute of Gastroenterology is a prestigious institution and brought laurels to Hyderabad in particular and Telangana in general. AIG stand apart and superior to other highly rated medical institutions because of its research and development activity. We are really proud to state that research is mainly based on the resources available in our own environment for better cure rather than accepting the pharma products reports from West or Europe. As we all know that health is the biggest wealth for a human being in his or her entire lifetime. One can survive without surplus money, but can't survive without good health. Health is something that we can't buy with money, but we can take care of it and we can cure it when needed with the help of the money. If a person is not having good health, he will not be able to enjoy his or her life to the fullest. Money doesn't make a person rich and happy, but good health does. Moreover, a person can't feel complete and happy without good health. Today, we are all curious to listen from the eminent and distinguished guest. Thank you.
Thank you. I now invite CA Arun Luharika, past President of FTCCI, for his special address.
Good afternoon, everyone. I know Dr. Reddy for the last 35 years, and I can say that he's not a doctor, but he is a great service to the humanitarian. Daily, he treats thousands of patients, and in continuation of his service to the nation and to the humanity, he has set up one of the best hospitals in the country, most transparent and most affordable. I refer almost couple of patients. Just now I have received a report from Calcutta of a patient, and which I will be sending to him, and I know he will give a quick treatment. So I salute him and always remain indebted to him. He must have saved my life at least a couple of times. Thank you, Dr. Nageshwar Reddy, and welcome to our federation. And I also thank Manish Shah, since I know him since 2000. Thank you, Dr. Reddy.
Thank you so much, Mr. Luharika. I now invite the Chair of the Healthcare and Disaster Management Committee, Mr. Shekhar Agarwal, to deliver the theme address.
Thank you, Kathy. Our honorable guest of honor, Padma Shri and Bhushan, Dr. Nageshwar Reddy ji, Vice President, India's largest private sector bank, HDFC, Mr. Manish Shah, our beloved President Ramakant ji, Senior Vice President Bhaskar ji, Vice President Anil, Advisor Naren ji, Co-Chair Shiv ji, Narayan Reddy ji, Past President Arun ji, CEO Kathy ji, friends and media, a very good evening to all of you. For missile, the word always remember Dr. Kalam. For quality and affordable medicine, often remember Dr. Anji Reddy. And as the best gastroenterologist of the world, we always remember Dr. Nageshwar Reddy ji. Sir, you are an iconic personality with great generosity, humanity, humbleness, and empathy. You are an outstanding teacher, a trainer, author, entrepreneur, scientist, inventor in transgeneric endoscopic surgery. Before Dr. Reddy took up this profession, therapeutic endoscopic was in an infant stage. Dr. Reddy took it to the greatest heights. Practically, he can be called as the father of the therapeutic endoscopy. Dr. Reddy is the reviewer in the best medical journal of Lancet. Sir, we and whole India, we are proud of you. And I also had, like Arunji, had a couple of opportunities to meet you in the old hospital and was more than satisfied. And we were really helped. And for a minute or so, I could talk to you. I'm really delighted. Sir, we request you to kindly educate us on three most important things. First, we are curious to learn more about the monoclonal antibodies injection of Casrivimab and MWGO. First, we came to know about this injection through President Trump. We are happy that now it is available in AIG, and AIG has already done a lot of work on it. Sir, we are deeply pained with the amount of sufferings and deaths because of first and second wave of COVID-19. Sir, request you to kindly inform how to prevent the third wave and also to prepare us for it from the prospects of the citizens, professionals, hospitals, and administrators. Sir, the most important is to provide quality and affordable healthcare, especially for all 4 crore citizens of Telangana. Request you to kindly guide from the perspectives of, again, citizens, professionals, hospitals, administrators, addressing the acute shortage of trained manpower, infrastructure, hospitals, beds, consumables, making the medicines and medical treatment affordable for all. Our federation would be happy to work with you in this regard. Friends, Bombay, there was a young and beautiful girl, 25 years old, who had her education in the best of the schools of IIT and IIM and working as an investment banker in a big multinational company. And once she had a stomach pain and she was taken to her family doctor, treated for some time, no cure, taken to the expert, could not get much relief, that super experts and specialists. But finally, it's found that she had a pancreatic cancer in an advanced stage. So some treatment was given, but ultimately doctors have to console this girl and had to tell that, and his name was Preeti. Preeti, we are sorry to tell you, but we have to tell you that you have got only now 6 months to live. Preeti asked the doctors, "Doctor, what should I do now?" Doctor thought for a minute and replied, "Preeti, you know many economists, many young economists, you can choose one and marry one." Preeti asked, "Doctor, will it save my life or will it extend my life?" Doctor replied, "Preeti, it would neither save your life nor it would extend your life. Only thing, by living with an economist, each hour will look like 1 year. By that, you may have feeling of as if you lived a life of 100 years. So friends, we can take it on the lighter note. Now, friends, personally, a lot to learn from Dr. Reddy. And most important are 3 C's from Dr. Nageshwar Reddy for a very quick learning. First is his great character. Second C is his great conviction. Third C is his great commitment. Fourth C is his credibility. Fifth C is his creativity. Sixth C is his capabilities. Seventh C is his culture. Eighth C is his communication skills. Ninth C is his connectivity. And now 10th C as a bonus is his contribution to the society. More than 1 crore of rural people are helped by him, by his rural services. So making and living a life to make the world a better place to live. Friends, thanks. Now we keenly look forward to listen to Dr. Nageshwar Reddy Garu. Good luck and goodbye. Thank you.
Thank you so much, Mr. Agarwal. I now invite Mr. Narendra Surana, the advisor of the Health Committee, to please introduce the guest of honor. Mr. Narendra Surana.
I am unmuted. Yeah, good evening, friends. It's my honor. Yeah, it's my honor and privilege to introduce Dr. Nageshwar Reddy, who has been a friend and a guide for my health issues as well. I have been going to him since 2001, 20 years back, when somebody said, if you want to live beyond 15 years, it's best that you consult Dr. Nageshwar Reddy. And since then, I have been going to him and I've been having perfect health. Coming back to the subject, Dr. Nageshwar Reddy is currently the chairman of Asian Institute of Gastroenterology, Hyderabad, and past president of World Endoscopy Organization. He has set up the most modern hospital in Hyderabad for gastroenterology, the AIG hospital, which is well known already all over the world. And he has recently been awarded the Time Magazine Award for one of the best hospitals in the world, top 10 hospitals. Dr. Nageshwar Reddy has come from a humble beginning, studied at Kurnool Medical College in gastroenterology, and then he went on to receive the Padma Shri in 2002, and in 2016 he was awarded the Padma Bhushan Award, one of the rare people who have been given both these awards. He truly deserves them because he is really hardworking. I have personally seen that he works from early morning, 5-6 a.m. in the morning to probably 11, 12 o'clock in the night. And it's a rare privilege for his clients and his patients who treat him like God when they approach him and they feel if they can meet him, that their life would be saved. He has been endowed with more than 20 different fellowships, the BC Roy Award and fellowship from Royal College of Physicians, Ireland, and many such. And also from the East, from China, getting one of the highest honor in 2013 to the American Association of Advanced Medicine, where he has received Rudolf Schindler Award and ASGE in gastroenterology, which are the highest awards that are possible. Dr. Nageshwar Reddy became the first ever Indian medical practitioner to get recognition from ASGE for his exemplary work in the field of endoscopy. We would definitely like to hear from him about certain things which he tried to explain to me when I met him last, which I could not understand. One was the different types of antibody tests, which are neutrality antibodies, S1, S2 spike, RBD antibodies, etc., and how it has connection with the possibility of getting this corona once again, in case somebody already has antibodies, either from previous occurrence of corona or from the vaccines. What is the correlation of vaccines and the antibodies, and whether the possibility of corona once again? And also the effect of 2DG, which was explained to us, but we would like to know more from him as well. So with this background, I would hand over the mic to Dr. Nageshwar Reddy to hear from him the various nuances of this subject, which is really affecting the entire world. And he has been doing a lot of research at his hospital. What he has informed me is a varied amount of research has been done on antibodies, and we would like to definitely hear from him whatever we can so that we are enlightened on this subject. Thank you very much.
Thank you very much, Narendra.
Over to you, Dr. Nageshwar Reddy.
Thank you much. Thank you very much for your kind introduction, Narendra, and of course my friends Ramakant, Arun, and Shekhar. Thank you very much for your kind words. I have been asked by FTCCI to talk on 3 areas. Now, they are little disjoint to the last one. So what I'll try and do is to try and talk mainly on what we know currently is very important, the monoclonal antibody that we are using for treatment of COVID-19. What is the potential possibility of a third wave and how to prevent it? And if we have time, we'll talk a little about the quality and affordable healthcare for all citizens of Telangana. So the last topic is very large. It will take us another hour to discuss. So we can go back to it any time later. But I'll be primarily concentrating on the first 2 aspects because these are becoming very important now. Now, can you see my slides?
Yes.
So I'll try and be not too much dependent on slides. As doctors, whenever we are talking, we are depend on slides all the time. But I know this is a very medical topic, so I don't want to depend too much, but I'll sort of use this as a guide to let you know what I'm trying to talk. It makes it easier for you to understand. When we talk about COVID in general, it's very important to know that this disease has several stages. The first stage is when you get an infection, you are asymptomatic for about 5 or 6 days. You don't show any symptoms. So this is the asymptomatic or pre-symptomatic stage. Then after that, for 3 to 4 days, you'll have mild symptoms. This can go up to a week also. It's called mild COVID. This is where most people are. And then you'll progress into a more severe symptoms of cough and so on. This is moderate. The next stage, which occurs usually after 1 week, is a severe stage, which occurs in about, say, 5% of patients, where you become not only have more cough, fever, but your oxygen starts coming down. So this we call the severe COVID. And some people, unfortunately, go into the intensive care unit requiring ventilation. This is called critical. Now, the reason why you should know about this is that if you look at all the patients of COVID, 90% of them have either asymptomatic or mild. About 8% will have moderate, 2% will become more critical, and ultimately 1% will die. So this is very important to realize, because all the while you see in papers or you know of relatives who have died or friends who have died, so suddenly this disease becomes very serious. It is not so serious. I mean, it is serious of concern, but we should not think that everybody who gets the disease dies. Most of the people, about 95% of the people, won't have anything. They'll just come out without any treatment at all. About 5% will have ultimately what we call the moderate to severe disease, and a small percentage, 1%, may succumb to this. But if you actually look at these figures more carefully, in fact, this mortality of 1% is much less than 1%. The reason is, not all the people in the community come to the hospital and report and all. So we, in fact, for every one patient who is reported in the community or in the papers or by the government, 10 times more actually have developed this infection. They are exposed to infection. So which means that the mortality is maybe not 1%, but 0.1%. That is, only a small percentage of these people will die. Yet, there is a mortality. And that's the reason why people are concerned. You compare this with common cold. Everybody gets common cold, but nobody dies because of common cold. Very rare. So that's the reason why more attention has been given to COVID rather than to, say, simple common cold. So this is important. The second important thing I want you to look at is this slide, this very simple graph. When you get this disease, it goes into 2 phases. The first 1 week, the virus is circulating in the body. The second 1 week is the virus is gone, but the body has fighting against the virus. And this fight from the body and the virus has produced a lot of chemicals in the body called cytokines. All the damage that occurs in the body is because of the cytokines. All the death that occurs is because of cytokines. So the virus itself is not causing the death, but the virus interacting with the body, releasing these cytokines, causes the death. And that's why people become sick after 1 week. In the first 1 week, they're happy. They have the virus. They don't know the consequences. In the second 1 week, they become actually sick. And by 3rd week, 4th week, some of them die. So this is what we are, it is important to realize. The reason is, when we treat these people as doctors, the first 1 week of fever or whatever it is, we have to treat the virus. And there are 2 main armamentarium to treat the virus. The first is the so-called monoclonal antibodies. The second is a drug called remdesivir. And I'm sure most of you have heard about all this, especially we've been using remdesivir for almost a year now. So we're getting very familiar with this. Monoclonal antibodies have been introduced only about 4 weeks or 3.5 weeks back. And this was the drug that President Trump got. So it got a lot of, I think, media coverage. Therefore, people know about it. But important to remember that after this 1 week, when the virus disappears in the cytokine phase, then these drugs don't help. What helps at that stage is steroids. One of the unfortunate things that has happened in this treatment of COVID over the last 1 year is that people think that steroids is the main treatment and steroids is being used here, everywhere. And that is resulting in side effects of steroids. The role of steroids is only for those people who become serious, and that too in the second week. Only in this group of people will steroids be useful. And that's the reason why we should be very careful when steroids are prescribed, or if your relative is given a steroid as outpatient treatment by some doctor on telephone, kindly advise them not to take. Steroids are serious business and they should be given only in patients who are in the hospital, usually in the second week. And this is one of the most unfortunate things that has happened in the medical field regarding steroids used in our country, because they're available over the counter. Everybody is using it and you're having a lot of side effects. So this is the role of monoclonal antibodies at this stage. Now, this became very important because if you can eliminate the virus in the first phase itself, then you don't have to worry about the second phase. People will get cured. That's the reason why we were using remdesivir earlier. And now we have a much stronger agent called monoclonal antibodies. And I'll go to that a little later. But before that, I wanted to understand this slide. There's been a dramatic change in the type of virus that is now present in the first wave compared to the second wave. This is just to show you the figures that in the first wave, which occurred initially in April, October, it increased in India. Most of this virus was the original virus which came from Wuhan. The Wuhan virus is called the yellow peaks are all Wuhan virus. And as we went into the second wave, which is in April of this year, see this blue one? This blue one is all Delta virus. 80% of the virus now circulating in the society is Delta virus. Now, what do these terms mean? Again, I don't want you to be confused. Just to, again, tell you very simply that normally what happens is this virus, when it's multiplying, it starts dividing. Lot of mistakes occur in the reproduction of the virus. That is, when the virus is circulating in the body, it tries to reproduce. So one virus becomes two virus become three virus, four virus. In the process of becoming 2 or 3 or 4, in the process of copying itself, it produces a lot of mistakes. And these mistakes cannot be corrected because the virus doesn't have the capacity. Like human body has a workshop inside to correct, virus doesn't have, it's too small. So this virus, which is mutated because of this division, then goes on to multiply itself. So this is called the mutation. These mutations, that is replacement of one amino acid with another amino acids in the virus, makes this virus either more virulent, more dangerous, more infectious, or other way around can make it very weak and disappear. So whenever the virus becomes more strong, like what happened in the second wave, then you get this big wave and people start dying. But when the virus starts mutating and becomes weak, as will happen over the next few months, then the virus will slowly die off and these epidemics will not occur. So this is to understand what this mutation is. And currently, the virus that is circulating in our society is called the Delta virus. Now, why should we be worried about this Delta virus? This is just to show you what happened. The Wuhan strain came from China. One virus could infect 2.4 or 2.6 people. In Europe, the so-called Alpha virus, the British variant came, and this was injecting about 4 to 5 people. That is more number of people. The Delta virus, one virus can infect 5 to 8 people. So you can see it is 60% more infectious. So it spreads very rapidly. And that's why in the second wave we saw many families were infected. One person in the family got, everybody else got because of this contagious nature of the virus. So Delta virus is more serious business than the original virus, the Wuhan strain, what we had. And that's why the reason became very important to try and contain this virus and cure the virus. So the main armamentarium we got in the treatment of this virus is this monoclonal antibodies. let me just concentrate a little on this, explain again. I know because it's all lay people here, even for doctors, sometimes it's very difficult to understand what these monoclonal antibodies and so on. Again, I'll tell you in simple language. When a virus or a bacteria affects us, the body tries to fight this by the innate immunity we have. We have a lot of cells which fight the virus. Very often, we can overcome the virus. But sometimes the virus is more powerful and can overcome us. So this is what happens normally. But the body also has a fantastic mechanism that whenever this virus or bacteria comes into the body, it also has some cells working in the background developing antibodies. These antibodies are very powerful, and if we can conquer this virus, if it comes and tries to attack the second time, this adaptive immunity which is developed in the body with antibodies will quickly kill the virus. So whenever you have a second attack of the virus, it is immediately killed by the body because there is antibodies circulating which can attack the virus. So this is very important to realize that antibodies form. Now, the way antibodies form is by natural infections, but we can also induce antibodies by giving a vaccine, and that's what we're doing now. We're giving a vaccine which is a dead virus or an altered virus, and that produces antibodies also without the actual infection. And these antibodies will now be ready so that even if you get a first attack, it will be like second attack, and the virus is completely eliminated. So this is the role of antibodies in the body. Now, when you give a vaccine, it will take about 45 days for the antibodies to develop. And within these 45 days, you can still get the infection. Is there any alternative? Other alternative is actually to extract the antibodies from somebody who has these antibodies and give it to you. So this is ready-made antibodies. Now, these ready-made antibodies we are taking from plasma earlier and giving it in our patient, but there's a problem here. The problem is it's very diluted. So the next step that has come is so-called monoclonal antibodies, which are made in the lab. So what we do in monoclonal antibodies is, as we see, these are very, very specific antibodies which are targeted against the virus, and they come from a single cell. So we take out the cell of a person who is already infected, a lymphocyte we call it, and in the laboratory, like in a factory, we can manufacture millions and millions of antibodies from this. And these antibodies are packaged into bottles, and a small dose of this, 5 ml of this, will give rise to millions of antibodies in the body to protect you. So this is an immediate protection that can occur from these monoclonal antibodies. So these monoclonal antibodies were developed last year from people who already developed the infection, and they are now available commercially, initially from a company called Roche, and Cipla from India actually is taken it from Roche and supplying it. Regeneron it's called. It's also available from Eli Lilly also, which is making these antibodies. So 2 companies are there. In the initial stage when President Trump got this infection, at that stage it was still experimental treatment. People didn't know whether it's effective or not. So President Trump, as soon as he was admitted, these monoclonal antibodies were given. The Roche one was given. What's available now in India also is given to him. Within 2 days, he became totally normal. His virus disappeared, and you can see he came back to work. In fact, the second day evening itself, he was going around the hospital in a car. So showing how effective this can be. So just to show you a cartoon of that, once the virus enters into the body, it fuses with the cell of the human being in the nose or in the lungs and gets inside, and then starts making its apparatus. So it's a very clever virus. It takes the body's own mechanism and starts using it to duplicate, and then forms these multiple bodies. Now, these antibodies which are formed by the body can go and bind to the virus, so that when the virus is caught in these antibodies, and this virus then, because it is surrounded by these antibodies, cannot enter the human being cell. So these antibodies, what we are now having, the monoclonal antibodies, will prevent the virus, once it's surrounded by them, from entering into the cell at all. and therefore the person is protected against this disease. So this is the concept of monoclonal antibodies. There are now several available, but the one which are available, I want to just mention these two names. These are difficult to remember even for doctors. They're called Kesarivimab and Imidivimab. Now, why two, not one? Two, because these antibodies go and bind against different sites of the virus. They're called spike protein sites, different sites. So if it's only in one site, the virus is very clever. It can change its shape and escape. But if it is in both sides, then it cannot escape. That's why two antibodies, so it's called the monoclonal antibody cocktail. It's given as that. So it is now we have looked at how effective it is against different viruses. We have the UK strain, South African strain, Brazilian strain, and Indian strain. And you can see against the Indian strain, these antibodies which are now available, these two ones, are very effective against the Indian strain. So there is a lot of research work going on, and of course, this has been approved now in most of the European countries and in Gulf. And on the beginning of June, Indian government also approved this. But unfortunately, the Indian government did not have data on whether it's protecting against us or not. So that's the reason why at our institute, we undertook one of the largest studies in the world on this, where we took every patient getting monoclonal antibodies, looked at the genomic sequence of the virus that's infecting the body, and matched and saw if the monoclonal antibodies protect. And we found that 90% of the viruses in our state were being caused by Delta virus, and we found that 95% of patients in whom monoclonal antibodies were given were completely cured from the virus. So we showed very clearly that even for this very dangerous type of mutant, these antibodies are protective. What has been produced for other viruses are protective. And as I said, it's always given as a cocktail form. Now, this is a very medical thing, so I don't want to go. The reason why I want to show this is there's a journal called New England Journal of Medicine, which is very, very famous. All the best articles are published in New England Journal. And the article on this monoclonal antibody was published there. And what did it show? It showed that the viral load by 3 days was reduced by more than 70%, 70% reduction in risk of hospitalization. Most of the patients, when this monoclonal antibody was given, were cured. There was no major adverse reaction. So you may ask me at this stage, okay, you're saying that everybody is cured. Why not we use this for all the people? Anybody who develops COVID, why not we use it? For this, I'd like you to go back to the old first slide I showed you, that 90% of the people are anyway being spontaneously cured. Only 10% have serious disease. If we can identify this 10 to 20% of the people who can develop a serious disease, then these 10 to 20% should be given monoclonal antibody, not everybody. The reason is, of course, also cost. This antibody injection costs about 70,000 rupees. So both the government or even the public cannot best give it to everybody we want because of the cost involved. And second is, if we give it to all the people, then the virus may mutate against this also. That's the reason why we give it selectively to certain group of people in whom this is indicated. Now, how do you select? We have now identified, because of all the research, which group of people, when they develop this infection, become serious. We have identified this. People who become serious, we can prevent them from becoming serious in the mild, or that's why I showed you the graph, the two graphs. In the first week itself, when they're very mild, if this combination antibody cocktail is given, then immediately within 2 days, the patient is cured. The virus disappears. The trick is to select the correct group of patients to give this antibody cocktail. And now we have solved that mystery. We know which patients will develop, and we give this. So what we do is, anybody above the age of 65 years who is obese, who has type 2 diabetes, who has chronic kidney disease, or immunosuppressed for any reason. For example, if you are taking steroids for some disease or cancer treatment and so on, or Anybody above the age of 55 years who has cardiac disease, hypertension, or lung disease, or even any child above the age of 12 years who has a BMI that is very obese. So it can be given to anybody, even children if they are very obese. The indications are these, because these group of people are the ones who will go into a serious disease if they develop a COVID infection. So we have now become very, very clear of who should be given these monoclonal antibodies. And in our research now, we have not only identified this group, we have found that if this group is given the antibodies, then your mortality becomes almost zero, which means with this correct selection of people and giving these antibodies, we can dramatically change the mortality rates of this disease. So we no longer have to be worried about this disease. The important caveat here is that one is selection of the right cases. Monoclonal antibody should be given usually in the first week. If you give it in the second week, I showed you it's no use. First week, usually within 2 or 3 days after the test is positive. So if you take an RT-PCR test of the nose and the monoclonal antibody is positive, then immediately this should be taken up and then given, and then you're cured from the disease. So these criteria are very important. The other important thing is that once you give these antibodies, you should not take a vaccine for at least 3 months, because these antibodies itself are acting as a vaccine. So you should not take a vaccine for 3 months, and only after 3 months you must take the vaccine. So I believe that these monoclonal antibodies are a dawn of a new era in the treatment of COVID, and that's why if you have a combination of vaccine and correct usage of monoclonal antibodies, we can completely eliminate this disease. We have now started a trial with an Indian company which is also producing monoclonal antibodies, which will be available soon. In fact, the price will then come down to maybe 10 or 15,000 so that it will be accessible to everybody. So I think this is a message that I'd like to give at this point of stage of optimism for this disease. So the take-home messages from the first part is that monoclonal antibodies are a game changer in managing early COVID. It can reduce the progression of the disease. It is well tolerated, and 99% of those patients in whom we are given have been given as outpatient. You don't have to get admitted. There is now evidence of benefit of Indian mutants, as a study has shown, and we are waiting for other studies from other institutions also to prove this. But in my opinion, it is strongly beneficial even against the Indian mutant or the mutant that we're seeing here in Telangana nowadays. So it's definitely very effective. So this is the first part of my talk. The second part I've been asked is about the third wave, and this is a question that everybody is asking. Will it come? When will it come? How severe will it be? Who will be affected, and can we prevent it? So let me try and answer some of these questions, because this is what I've been asked very frequently. So will it come now? Now, if you look at the graph that has occurred, if we compare what happened to US and in India, see, I'll follow this Indian graph with you. See this Indian graph? We had the first wave somewhere in September, October, then it went down. Then we had this huge wave somewhere in April, May, and it's coming down now. Compare this with the United States. They already had 4 curves. They had the first wave, second wave, then a huge third wave, and a small fourth wave. So different countries behave differently. So what we call a wave is a huge cluster of cases that occur at one instance. So this is, in India it occurred in 2 instances, in US it occurred in 4 instances. But if you look at historically, and this is very important, the Spanish flu, you see first wave occurred initially, and then as in every other wave, the second wave was very serious second wave because the virus got muted. Then the third wave occurred and a small fourth wave. So historically, this occurred over 2 years, 1918, 1919. So what will happen to this virus? This virus also, the first wave we had, the second wave was big. we are going to get this third wave, definitely, but it will be in a very, very muted fashion. And we may get a small fourth wave. And ultimately, over the years, this virus may become endemic in the population. That is, it will become like common cold and cough. Say in winter season, some of the people may get cough and cold, maybe because of this virus. But by the time everybody is taking vaccines, so everybody is protected, it does not have serious consequences. More therapies like monoclonal antibodies will come. So this will just stay very low grade in our community. So this is what I would forecast in terms of what will happen. So will it come? It will definitely come, the third wave. When it comes, when will it come? So this is not so easy to answer because it depends on a lot of factors. It depends on mainly human behavior, whether we can have this COVID appropriate behavior so that we don't get affected with this. So this is predicted that it will come in 8 weeks' time. So one can expect somewhere in about September that we may have a small wave, the third wave. So it will definitely come. The second point is it will be expected in September. How severe will it be? Again, I want to be very optimistic here. This will not be severe. It won't be like second wave for several reasons, because the mutations are not always making it more severe. Mutations can make it weak also. So that's the reason why the third wave mutation will be weak, and it won't be severe. It will be very mild type of third wave. There's a strong rumor in the community that children will be affected. In fact, government is telling make children's hospitals more efficient, increase ICU beds. But I think this is not right. I don't think children will be more affected in third wave. The reason is children are already affected by this virus in second wave itself. Some studies in Bombay, for example, we had a paper recently showing that 50% of children have already been exposed to this virus, even if they don't get any infection. They already have antibodies. Now, why is it? This virus, fortunately, cannot enter into the children very easily because children don't have a receptor called the ACE2 receptor. Now, all of us adults have these ACE2 receptors in our body, so the virus enters through this. Children do not have this, or very low quantity, and that's why it cannot affect. So the children are very, very minimally affected, and even if they're affected, their antibody levels are already high. So in the third wave, this prediction of children being affected is not right. Children are already affected, and fortunately, even if the children gets affected, it will be very, very mild infection, which will go off without any problem. The third good news is that children, now vaccine also is being tried for children. 2 or 3 vaccines are already on the road. By September, we'll have a definite vaccine for children. Even young children above the age of 2 years will have vaccines, so children will get. So for all these reasons, a mild third wave will come, maybe in September. It will be very mild form. Children won't be predominantly affected, it will be adults only, and it will slowly come down. And for the next year, I think this virus will be in a mild endemic form with us. Now, all these predictions will come through provided we behave appropriately. So I've been asked this question many times, can we prevent the third wave? Of course, we can prevent the third wave, and we can prevent the third wave by this. If you take a vaccine and all of us do appropriate behavior, COVID behavior, that is very simple. Wearing a mask. We can discuss if there's any questions on the mask. We can wear N95 mask is now being available everywhere for everybody, but sometimes most people find it difficult to breathe. You can wear a surgical mask on top a cloth mask when you have exposure. It's very safe. Or in the house, you have other people roaming around, you can wear a cloth mask. Or if you're visiting a very, very highly infected area like a hospital, you must wear double mask. You must maintain a distance, physical distance of more than 6 feet, and of course, personal hand hygiene and so on. It has been shown that the so-called COVID appropriate behavior can decrease your rates of transmission by 90%, as good as vaccine. Plus, if you already take the vaccine, you will be 100% protection. So if now society, everybody starts taking the vaccine, everybody starts COVID appropriate behavior, then there's no question of third wave at all. So we can prevent it. Regarding this vaccine, I just wanted to tell you briefly little and about this virus. So you see, this September we had the first wave, May we have the second wave. We estimated the genomic sequence of this virus in this first wave, second wave, and you can see the blue here is Delta virus. In the second wave, it's all Delta virus. What we did is we vaccinated all our staff the first time after the first wave. So first wave, they were not vaccinated, 400 got this. Between the first and second wave, we vaccinated all our staff, 2,000 people. And you see that in 60% were protected. Rest of the 40% developed mild infection, and majority of them were completely cured without hospitalization. So this vaccine protects everybody from this virus. And when we looked at all the people who got infected in spite of the vaccine, again, you see it's majority Delta virus, but all the infections were mild. So what the vaccine does is not only protects you, that even if you get infection with Delta virus, it makes this infection very mild. So my recommendation is that for all of you is to take this vaccine extremely serious. I know that most of you have taken the vaccine. You must also make it a point to give it to your staff members, to all the people working in your factories, to make it a compulsory initiative, so that by protecting themselves, they're protecting you, they're protecting society. So this becomes extremely important. Although we have the Brahmastra in terms of the monoclonal antibodies, vaccine becomes very important because it's much cheaper when you take the vaccine, and the protection is extremely high. Narendra asked me about this antibody protection also at this level. At this point of time, let me tell you that when you go to the lab and you tell them, can you do my antibodies against the COVID? Many of the labs are doing some antibody test and giving a result. This is not right. The antibodies which are going to protect you definitely are called the neutralizing antibodies. And we use the term S1, S2, that is spike 1, spike 2. Only if these neutralizing antibodies S1, S2 are above 100, you are protected. So next time, if you want to get your antibody level, you specifically have to ask the lab, don't do any antibody, do S1, S2 antibody. These are the neutralizing antibodies, and see if the result is above 100. If the result is above 100, then you're protected. If the result is below that, my recommendation is you might have to take a third dose of vaccine. Many people are giving a third dose of vaccine. So there is some controversy in the literature whether antibody levels are exactly equivalent to protection and so on. We don't want to go into that. But in general, if your antibody levels are low, the chance of reinfection is there, and you have to get a third dose. Third dose will protect you. Now, can you take one vaccine? Say you take Covaxin first dose, Covishield second dose. Right now, we don't know. But you can take Covishield first dose and any of the other vaccines like Pfizer or Moderna as a second dose. In fact, next month, both Moderna and Pfizer are coming into our country. And those who have already taken Covishield, for example, if you want to take a third dose, you can take one of these vaccines for long-term protection. So those are some of the things I want to clarify now. Now, the third one I've been asked to speak, I don't want to go too much into this, about healthcare perspective in our state, that can we give quality, affordable healthcare for all citizens of Telangana? So Telangana has about, I believe, 3.75 crores. Somebody asking something? I can stop here and take questions, and then if we have time, we can take this.
Sir, you can continue.
Yeah.
There's nobody who asked.
Just 2 or 3 minutes. This is just a few thoughts to prick your brain and let you get. And then I think we must have a separate seminar on this, because it's a very important topic on giving affordable, accessible care to all the people of Telangana. Telangana has a population of about 3.7 or 4 crores, out of which access to care, good care is only for about maybe 20% of the population. 80% or 75% of the population do not have access to good care. When you say good care, there are 3 things that you must think of. One is availability, second is accessibility, and third is affordability. Now, If you go to our rural areas, governments have set up PHCs, CSCs, and so on. Unfortunately, care is not still available because majority of these are just small buildings which are not manned properly. No manpower is there, no equipment is there. So they are just on paper. Similarly, in many areas, accessing to a proper higher center is not there because of several problems, including most important affordability. An ideal utopian society should have healthcare where 100% of the people are insured. Nobody has to spend out of the pocket. And I think we have many statistics from World Bank and so on that 60 to 70% of the population is now out of the pocket expenses that they're using for healthcare, and about 25% of the population is totally destroyed because they can't afford this healthcare and they're spending all the money in this, selling these properties and so on. Only about 1.25% of our GDP is spent on healthcare. So there is an equal responsibility between the government and the private enterprises to come together to see how to make it accessible. There are many government schemes, Shri and central schemes, which are now available, but there are a lot of lacunae in the schemes in terms of what can be used, what cannot be used, hospitals, how they're not properly using it, what is the misuse of the schemes and so on. Again, long discussion we can't go into. So there is an affordable population of say 10% who can get the best care. What I can tell you is that I've been around all over the world, and this 10% who are getting this care in private sector in our state get as good care or better care than even in New York or London or so on, because we have everything here. But unfortunately, it's only for that 10%. There are ways of increasing this by insurance and so on, how government can partner and so, but that's a law. That's a very, very big topic. We can discuss this later on, maybe in some questions. But I thought predominantly today, I'm going to concentrate on COVID and what are the advances that occurred. So again, I'd like to thank the Federation of Telangana Chambers of Commerce and Industry for giving me this opportunity to talk on this area. And I'll be glad to take up any questions. So should I see the chat box myself, or because the questions I can see the chat box?
Yes, doctor. I think some of them are in chat box.
Thank you.
We have received some, I think, more than 20-25 questions well in advance. But chat box questions, I think you can directly answer.
So we have from the chat box a few questions which are coming in. There's one question which is coming from Sai Prakash Chigulappalli. He says that the third wave in US graph is severe. Will it not be the case in India? No. In US, what happened is the third wave occurred very early. The first two waves were very small. So third wave became prominent. In India, the second wave has come late. So the third wave will be very moderate in nature. A question from Ganesh Iyer is, can pregnant ladies and lactating mothers take the vaccine? Now, regarding lactating mothers, yes, they can and should. The reason is these antibodies cross the breast milk and the child also will get benefited. So we are now advocating lactating mothers to take. Now, regarding pregnant ladies, there's a confusion. In US and UK, with the Pfizer and Moderna, they are allowed to take because studies have shown it very safe. In India, we still don't have studies, although I personally feel it is safe. But the Ministry of Health India has not recommended vaccine to be taken during pregnancy. Because the two vaccines we have now, the three vaccines, COVID, Sputnik, and Covaxin, have not been tested in pregnant ladies. So currently, they're not recommended. But lactating mothers should take. It's important. We have a question from Vamsi Krishna who says that D-dimer is high after 45 days. We are using blood thinners. What do we need to get worried? One of the most important things, Vamsi Krishna, I want to tell you is don't bother about all this D-dimers, IL-6 and all that. I think one of the things that has happened with COVID is that now everybody, even a lot of non-medical people have become COVIDologists. They go to the internet, they read about things, they hear TV, every news is about COVID. In fact, I saw some of the even non-medical doctors giving expert talks on COVID and everything. So COVID, don't kindly look at any parameters. If you're feeling well, if you don't have fever, you're all right. There's no need of taking blood thinners. The D-dimers can be high for sometimes 2 months. It doesn't mean you must take. Blood thinners should be taken only for 2 weeks and stop the blood thinners. It doesn't matter if D-dimer is high. D-dimer, we should never treat a biochemical result or a shadow on the X-ray. It should be clinical treatment. So we don't have to take it off. So what does, another question that is asked by Sai Prakash is, what is the protection of 60% of the vaccination mean? Which means that all those who took vaccination, the chance of developing the infection comes down from 100% to 40%. And even the 40% who developed this, only about 1 or 2% had moderate. Means everybody had very, very mild infection. So if you take that statistics, you can say that vaccine is protecting 98%. 60% against any infection, 98% against a more severe moderate infection. In the survey of ours, the question with Avinash asking is whether everybody, all the staff have been vaccinated, all our hospital staff have been vaccinated. So this is one of the things. And we have another question from Mr. Gelly. If you want to take a third dose, what should be the time gap between second and third dose? Under what situation of antibody level should one take third? So if you want to take the third dose, the minimum gap between the second and third dose should be 4 weeks. Up to 6 weeks is okay. We must take the third dose of same vaccine you have taken earlier, unless you get Moderna or Pfizer. And antibody levels, if they are very low, say normally below 40, then you take the third dose, otherwise not necessary. There is some controversy in this area. All the doctors don't agree. Some people believe that just take 2 doses, don't do antibodies, even if antibodies are low. Cell immunity is helpful, but I think this is still controversial. I would recommend that if your antibodies are low, you can take a third. So this is another question from one of the audience saying 60 years, he has taken 2 doses of Covishield. Can he go for testing? You can, it's not compulsory. Most often we are advising this testing for those above the age of 65, those who have other comorbid diseases like diabetes and so on. Now, I think another question that Chetan Kumar has asked is, can we give some insight into Delta Plus? Now, Delta Plus is a new variant that has come, which has been a lot of talking about. But fortunately, in our research, we have found that we don't have this in Telangana. We have done thousands and thousands of samples, genomic analysis. We haven't found Delta Plus. Delta Plus is one additional mutation on the Delta virus itself, which has made it much more infectious and virulent. But fortunately, Delta Plus is only about 100 odd cases have been reported. Most of it some in Maharashtra, some in Kerala, and so on. It has not come to our place, and the way it looks like, it is going to die down. It's not going to cause a main problem. Now, Murli Krishna, sir, can you suggest whether father 92 years can be given vaccine? So Mahesh Chand Gupta asks whether 92 years old father, yes, 92 years also vaccine can be given very safely. We are given even a 100-year-old person the vaccine, it's very safe, no problem. Murli Krishnamurthy asks, can a patient be asymptomatic but exposed to the people? Can he get sudden heart attack or die? Patients can be asymptomatic. About 1 to 2% of the people will carry this virus without developing symptoms. Or in the pre-symptomatic stage, before they develop any symptom, they say asymptomatic. It is very important to remember that asymptomatic people have a very low amount of virus. They do not have the effects of the virus. They can transmit this virus to others, but for themselves, no danger. Sudden heart attacks and all do not occur because of asymptomatic virus carriage. So you have suddenly a person has a heart attack, and by chance they detect this RT-PCR positive, they'll immediately blame and say COVID is causing the heart attack. That is not right. This COVID can cause heart attack in young people only after giving severe infection, not in asymptomatic. So this you can take it very short. Dr. Srivastav is asking about when the third wave will come. I already explained. We're expecting it in about September. Will it affect the children? No, it won't affect the children. Third wave, in my opinion, will not affect, because children are already infected to a large extent. Most of them have a lot of antibodies. Now, Ramesh is asking what is the post-COVID complications. So I didn't go into this because of the time. We have what is called long COVID. Long COVID is about 20 to 30% of patients who have survived or who have gone through the severe COVID can develop post-COVID complications. This can be in form of breathlessness, generalized pains, arthralgia, developing autoimmune disease, sometimes depression, sometimes neurological problems or cardiac problems. These are all called long COVID. In fact, it is becoming so common that in our hospital, we have now opened a long COVID OPD, the outpatient department only for long COVID patients. So these patients who had COVID recovered completely, after 2 or 3 months are coming back to us with these symptoms. So then we evaluate them. What is causing this long COVID? It can be antibodies, it can be residual infection. Whatever is causing it, we treat it and then they can overcome it. So this is what we are now finding commonly. We have asked Mahesh Chand Gupta again asked what's the gap between 2 doses of Covishield? It's been increased to 16 weeks. Now, regarding these doses, Covaxin, you have to give 4 weeks dose. Sputnik, 21 days dose. Covishield, there's a lot of controversy. Government initially made the gap 4 weeks, then made 8 weeks, and then made 16 weeks. Part of the reason is it has been shown that a single dose of Covishield is enough to protect. And even if you take the second dose after 8 weeks, 16 weeks is still effective, or maybe more effective. Part of the reason also is because of lack of vaccines at that point of time. But now, with the Delta virus coming in, and even the British government has recommended that we take the second dose of Covishield between 4 to 8 weeks. That is maximum 8 weeks, minimum 4 weeks. So I would recommend Covishield to be taken, if you can have access to it, by about 8 weeks after the first dose. So how are the monoclonal?
And what about the Covaxin, the third dose?
Covaxin is 4 weeks. We cannot extend the time.
And
it has to be taken 4 weeks, 28 days.
Third dose also?
Yeah, you can take third dose also, but 4 weeks. Now we're recommending third dose of Covaxin after 4 weeks. The other question is, how are the monoclonal antibodies administered? The monoclonal antibodies is usually given through IV as an IV saline or can be given subcutaneous. It is not through government like the other drugs like tocilizumab and all which are given through the government. Monoclonal is available freely in the market to the hospitals. So we have it with us, and if we decide that this patient requires it, then we give it. Fortunately, it has not gone out of stock like other drugs, so government doesn't control it. We can still use it provided it's used carefully, which is given directly. Then the other question is, can everyone take vaccine or any patient we should avoid? In general, vaccine at present, we are avoiding in pregnant women. We are also avoiding vaccine very rarely in those patients who have a coagulation disorder. There are a very rare group of patients like hemophilia and so on who have coagulation disorders. The third is there are a small group of people who are hypersensitive to any drug. They develop allergies. So these are the 3 groups we avoid, but generally it can be given to anybody. The other important question Mamsi Krishna has asked is, after you're cured from COVID, when do you need to take the vaccine? After you're cured from the COVID, the recommendation is to take the vaccine after 3 months. My recommendation is anywhere between 1 month to 3 months. The official government recommendation is 3 months, but I would say anywhere between 1 month to 3 months. The reason is your antibodies are being produced by that time. After 1 month's time, you're still mature, antibodies come. If at that time you stimulate the body, then it reacts very well. So anywhere between 1 to 3 months. So Prakash Amboli asks that in spite of vaccination, some people are dying. Now I want to clarify this because it's very important. We have heard instances where people have got the vaccine and died. There are several things in this. Number one, if you take only one dose of vaccine, it doesn't completely protect, so you can still develop a severe infection and die. If you have taken 2 doses of vaccine, the full efficacy comes only after 15 days of the second infection. So you can still get a serious infection after before 15 days. So these are the 2 circumstances you can get a vaccine and still get serious infection. The third circumstances is if a person is on immunosuppressive drugs. There are many people taking steroids or other drugs. There was a very famous doctor who died after 2 doses and became viral. The reason was he was taking immunosuppression for some other disease he had. And because of that, he developed this. So you can also develop this disease if you have some other disease and the vaccine is not effective. The fourth reason is that if a person has severe kidney disease or cancer and so on, the vaccine may not be effective. So in this group of people, you may have to take a 3rd dose of vaccine to be more protection. And the last reason why the vaccine is not effective is if the vaccine has not been properly stored. Now this vaccine comes in a vial of 10. So when you take out one vaccine, all the 10 doses have to be used within that time. If it is not used, and again somebody is not putting it in fridge and using it next day, then the vaccine efficacy is not there. Unfortunately, in some centers, especially rural areas and peripheries where access is not there, some of these people are using the vaccine like this, and that's why not efficacy. So that's why whenever you're going for the vaccine, try and go to a place where it's standardized. Even some government places are very good, and inquire from the person who's giving the vaccine whether it's coming from a vial which is used the same day. Otherwise, the efficacy may not be there. So that's it. So the other question from Bodhi Cherla is, my father has weak kidney. Should he take the vaccine? Is 76. Yes, he should take the vaccine. Make sure that after the 2 doses are given, check his antibody levels. If it is not adequate, then you can take the 3rd dose or whatever he requires. How much time? That is 3 months already. We answered this. Now, the other Prem Kankare asked that after taking 2 doses of vaccine, there was no fever. He's not sure whether the vaccine is effective. Now, if you take the vaccine, some people develop fever reactions and so on. Not all people develop reaction. Just because he didn't get fever, it does not mean the vaccine is effective. Not effective. Vaccine, if it's properly given, is effective. Some people don't develop any fever, any local pain or anything. It just by itself, it's still effective. But if you still have doubt, you can get your antibody levels done. Yeah, I think Arun has some question. Arun? Yeah, can you unmute yourself, Arun?
So, yes. I think some of the questions you can skip, doctor. It is repetitive in nature. I have got almost 25 questions.
So shall I stop with this chat box then? Because there are so many, I can see hundreds of questions.
Yeah. No, not required. I think
people are still asking in the Q&A also box.
No,
so maybe what we can do if you want is that if you can send these questions by mail to us, we can send back the accurate answers to all the people who have asked these questions also if you want.
Yes, doctor. One question, it is repeatedly being said that the vaccine being administered now do not have capacity to face the beta plus variant.
Delta plus. Yeah.
So in this scenario, how to face 3rd wave is one question it has come. But already you have explained in detail about that.
So Delta plus is not very large. And we are not sure whether the vaccine is effective against Delta plus or not because such a small number. We can't test that hypothesis now.
Another question, what is your opinion of mixing the vaccines and usage of ivermectin as a prophylactic?
No, ivermectin is not useful. Don't use ivermectin because several studies have shown it is not useful. In fact, the first week of treatment, there's no treatment. Either if it is more likely to become severe, you take monoclonal antibodies, or if you don't have access to that remdesivir, no other drug is effective. Just stay home, hydrate yourself well, eat well, and so on. but the ivermectin, all these antibiotics are all being misused. They should not be used. Mixing of the vaccine, we can currently mix Covishield with Pfizer or Moderna, but there's no data on mixing Covaxin and Covishield. So we should not mix Covaxin and Covishield.
Thank you, Doctor. By and large, all the questions are answered, and your talk was so clear that there is no doubt left. Unfortunately, I couldn't meet you personally. Like all my past presidents are your patients, and they know very well. But I didn't have an opportunity to visit.
No, that's a good thing that you didn't need at the hospital. Yeah.
Thank you, Doctor. Yeah, Kathy, over to you to take forward.
Yeah, thank you, Mr. Reddy. And Dr. Reddy, like you suggested, I think we will put our email ID in the chat box. And if they have any questions, we will compile all and send it to you so that, your team can then respond to them. So we will circulate that information tomorrow to all our members if they have further questions to this.
So I have a question. Why does FTCCI have a CEO, separate CEO? I thought each company had their CEOs.
Yeah.
Okay.
Yeah, I think.
Sir, okay. If any of the office bearer wants,
and to run the secretariat, the office bearer engage a CEO.
Office bearers will change every year. There is a body, elected body, but CEO and office remain same to interact. The continuity in interacting with the government in policy making and all that. So the continuity of the office will be there, and CEO heads administration and all the activities.
Also, the CEO is not appointed by FTCCI, not the government.
Yes.
Not the government.
Yes. It's appointed by
and it's a permanent post.
Yeah, it's a permanent post. Like
CEO is appointed by the office bearers. And office bearers are elected by the members.
But office bearers change every few years. Then they change the CEO also, but CEO is constant.
No, CEO. We have a MC, like management committee is there with the 39 members. And office bearers will change every year, but MC will continue. They also will change. There is an election process like the government, and it's a process. Like there are 5 categories like industries, associations. We have indirect members of 25,000 people and direct members of 3,000 industries and various.
It's a very responsible post.
Yeah.
Thank you.
So you continue to see me, sir. even if the head table changes. Yeah. So we still have one more presentation. So sir, we just wanted to check with you if you're still going to be with us for a short while.
Actually, I have a surgery. I have a surgery lined up, operation lined up. So I'll be going on to that.
Okay, so maybe I can just request the Vice President to propose vote of thanks for Dr. Reddy, and then we move to Mr. Manish for his presentation. Unmute yourself.
Yeah, good evening, Doctor. It was a nice talk. It's my privilege to propose vote of thanks to Dr. Nageshwar Reddy, Chairman AIG Hospital, who is Padma Shri and Padma Bhushan also. So thank you for sparing your valuable time in spite of your busy schedule, sir. And on the topics of monoclonal, we as a common man, we can understand as cocktail. I heard about the cocktail. My friend's mother also recently, she was in the AIG hospital, and she took that cocktail medicine, and she was out within 2 days. She's 83 years old, and she came out within 2 days out of the hospital. So thank you for your interesting and knowledgeable, sir. Sir, we know how hard that AIG hospital is working, and we are proud that we are living in the same city where AIG's hospital is also located. Saying much about you is like showing Diya to the sun, sir. You are a well-known, world-known gastroenterologist. Sir, I think all the participants must have got benefited out of this webinar. Sir, you said about the third wave. It is heartening to know that, sir, third wave will be milder. It's a good news for us, sir. And regarding this cocktail, it's a dawn of new era, and we are expecting such treatments, more such type of treatments in near future, sir. More dawn of new era should also come in these COVID periods. And I thank managing committee members, past presidents, sir, and participants for their participation and media for their coverage. Last but not the least, sir, our FTCCI team for arranging this webinar successfully. For arranging this webinar successfully, sir. Our FTCCI team, they have taken a great initiative, sir. Thank you. Stay safe, stay healthy.
Thank you very much. Thank you.
Thank you very much, sir. We'll be in touch with you.
Thank you.
Thank you so much, sir. We move to the next part of the session, and I invite Mr. Manish Shah, Vice President of HDFC, who will share his thoughts on why insurance during such time is very crucial, like the significance of insurance. So over to you, Mr. Manish Shah.
Right. Thank you, Kathy. Thanks a lot. First of all, good evening to all the members. I first of all thank FTCCI for giving us an opportunity to share a platform with Padma Bhushan, Padma Vibhushan, Nageshwar Reddy Garu. It's been a privilege. In fact, it's cleared a lot of my own doubts. And I'm sure as a member of the bank, we are also COVID warriors. I would be able to spread the message what is given, a lot of positivity which we got from this. So thanks a lot for allowing us to be a part of it. Now, coming to the agenda, Nageshwar Reddy Garu already mentioned it to us. The three pillars of healthcare, which are very, very crucial and important: the availability, the accessibility, and the affordability. Now, as he mentioned, only 10% of the population is able to afford the healthcare treatment. And we've seen enough of our friends, families, known associates who suffered COVID, who would have really had a deep dive into their pockets for the treatment to save the loved ones. Now, this is what requires, this is what demands what we as a country need to look forward for, which the Western culture has already implemented. If we go back to West, we see that every country mandates health insurance, something which we are not doing in India. So I think health insurance is a very, very important and a crucial part of our life. Each and every person could be from self-employed to a person who's salaried or to a person who's working with any of our organizations. I think health insurance is a very, very mandatory thing. Just to mention few important and good things which the government also has done on this line. As we saw the first wave of COVID coming in and we saw the fatalities increasing, the mortality rate increasing, the government of India also came out with a policy to all the insurance companies saying that every company should offer a COVID related policy exclusively covering COVID right from day one. And that's called a Corona Kavach policy. Now this policy, if you see, is not a very expensive policy. For the matter of fact, it covers anyone between the age group of 17 to up to 65 years of age person. Can cover individually or a family floater. And the policy is also a short-term policy, goes up to maximum 9.5 months of period, because we saw COVID that it's not going to be a long-term activity. As we see the vaccine already available, we might not see COVID to be that strong the way it seems to be today. And the premium cost, if we speak about, for the highest age bracket at 65, works out to be only around 9,100 rupees per annum. And this comes as a deduction for income tax. So I think this is important that we all need to take this ownership and responsibility, that we make sure we, our families, our friends, our relatives, our colleagues, our associates who are working with us, we do tell them that they should be having a exclusive policy, either a COVID Corona Kavach policy or a healthcare policy, whichever they feel free to take it. The government also for industries, because I'm speaking at FTCCI, we have a lot of manufacturers here. The government also has come out with a policy that anyone who employs more than 10 people should have a mandatory medical insurance and can go up to a basic of 1 lakh premium, and it doesn't cost more. As I tell this to you, even if you have 10 employees working in your organization, you could take a medical cover, a group medical cover, where the cost of insurance is not more than 2,000 rupees, but it covers a host of more than 160 odd diseases and ailments. So my sincere request FTCCI has always been promoting the business, have been promoting the industries. We've seen who's who in the India, who's in the country, who's in the state of Telangana being developed who are a part of this. So my sincere request to all of you, we should promote it across to all our members, saying that to their employees, to their staff, we also need to make sure that we take either a mandatory medical cover or a group medical cover, or if not anything, as basic as a COVID Corona Kavach policy. So that's a sincere request which I would like to present it from the bank side and from the personal side also. So I would like to take, if there are any questions, anyone would like to know more about these policies, I'd be glad to answer them.
Yes, Arunji, please go ahead.
Manishji,
Sir,
I have only one question for you. That you are a bank with a deep pocket. So you should promote our activities. You know, you put a separate budget, at least 8 to 10 lakhs you should spend with on our programs, and then you will see the results. Because when I was the president, before that also, so many times I have tried with the bank, but the bank has been very miserly in, sponsoring our programs. Once you are large-hearted, then you will see the result.
Surely, sir. Take this as a feedback and we'll definitely jointly work along with you, sir, going forward.
Arunji, many of their members are the already customers, HDFC, big customers. Myself is a customer of HDFC Bank.
Absolutely, Anilji. I remember having met you across at your unit there.
Yeah.
So, Manishji, can you explain about this group policy? So, where the 100 employees in an organization, will it go like, is it a telescopic? Suppose some of our industries have 20 people and some of them are in 50 to 100 bracket and some of them more than 100, 150. So how this the cost and premium works out in general? I'm not asking very specific.
I understand. So Bhaskarji, as I told, what happens is this medical insurance. Earlier, maybe around 5 years ago, it used to have a minimum strength of 100 staff members. But over last 5 years, we've realized that medical insurance is a necessity. It's no more a luxury. And it's necessity for everyone, irrespective of the class, irrespective of the income group. So what we've done in Across is also is, as you rightly quoted, a few of the companies, few of the corporates, few of the industries would have as low as 10 employees. So group medical, which we call it GMC, group medical policies. These cover for a minimum of 10 employees. So the moment you have 10 employees, you could give us a requirement. What we take in Across is what is the age bracket at which the people are. Basis the age bracket and the coverage which you wish to have. Few people prefer to have a 2 lakh cover, few people have it at 5 lakh cover. Few people also ask us for a family cover. So we provide all the three. So depending on the amount and the age, we come out and give you across a premium.
Right.
So as a group, the advantage is, sir, that we all are contributing in the kitty for 1 or 2 eventualities or 1 or 2 requirements or emergencies.
Yeah, I understand. Thank you.
Yes, sir. Thank you, sir.
Thank you, Manish. So then I think there is an opportunity. So our insurance and banking committee is active under their guidance. We would like to organize one program specially for the explaining what are all the various schemes available. And there we can invite all the industrialists with a specific purpose of covering their employees and group policies and that kind of a stuff. I think that would be wonderful, and I invite you to join. We'll be in touch.
Would be a pleasure, Bhaskarji.
Kathy, over to you.
So thank you. Yeah. Thank you so much, Mr. Shah, for the detailed explanation. And like Mr. Reddy said, we will take it up from here. And in fact, this was more like a precursor. And I now request our Vice President once again to propose vote of thanks for Mr. Manisha and all the participants so we can close the session. Unmute.
Thank you, Manishji, for your support and address to our members regarding insurance. As suggested by our senior, we'll take up another program, especially on insurance. So we'll be in touch with you. Thank you.
Thank you, Anilji.
Thank you.
So thank you once again to all the participants, and in case you have any questions, please send it to us so we can then forward it to Dr. Nageshwar Reddy for his team's response. So thank you, and we shall close the session.
One question to you, Khyati. I received 20 questions, out of which one question is how to join FTCCI. That you would have answered directly.
Okay. Bye-bye. Thank you.
Thank you very much, Shekharji, for a lovely program initiated by you.
Thank you, President, Senior VP, Khyati.
Thank you.
Manishji.
Thank you.
Thank you. Arunji is left.
Bhaiya, your efforts.